Probably our most common phone calls, pediatricians, are about baby rashes. Baby rashes are so common, and most of them are benign. So a newborn can be born with a rash, which parents often freak out about, and it's usually nothing. So babies can be born with rashes, or they can come out in the first week of life that look like little red dots, almost like a pimple, from head to toe, and that's called erythema toxicum. It has a really frightening name, but it's a completely benign rash, and it'll go away on its own. As babies get a little older, they have sensitive skin, and they often get rashes on their cheeks, in their necks, all over the place. So what do? So if your baby has a little irritation, often from drooling or rubbing their cheeks on their mattress or on your clothing, I just usually recommend a barrier, like a petroleum jelly or a glycerin, any kind of cream that's hypoallergenic and safe. I would recommend putting it by the eyes. And you can make that barrier cream and put it on twice a day, and that really helps prevent most common, what we call dermatitis or common baby rashes. If your baby seems excessively itchy and seems to be scratching their skin, then that would be a reason that you should call your doctor. Some babies do have eczema, and your doctor might recommend something over the counter for it, just like a moisturizer, or if it's more severe, your doctor might actually recommend a little bit of topical steroid on that. Babies get rashes under their necks often because they drool and dribble, and the milk collects in these creases. Babies have a lot of creases. They also often get little rashes in their underarms, in the axilla, and also creases in the groin because those are hot, wet, moist places, and those rashes might be fungal. You usually need a medicine to cure those. Your doctor might give you some nystatin antifungal cream to put in the baby's neck twice a day for a week, the underarms or the groin. Those are the common baby rashes that we see. If your child seems to get recurrent rashes, your child might be atopic, which is very sensitive or more towards being allergic, and you should talk to your doctor about that. If you have a very dry home, another good idea to prevent rashes is to keep a cool mist humidifier going, because that'll keep the baby's skin nice and moist. I always recommend a cool mist humidifier because it grows less bacteria and there's less risk of an accident. If it's a warm or hot humidifier, a child could pull it down and they can scald themselves. So I usually recommend a cool mist humidifier.